My name is Patty Williams. My husband is Buck Williams. He's behind the camera back there. We are Tommy's parents. Tommy was born June 7th, 2005. He was healthy, 9-pound, 6.5-ounce baby. At 4 months old, Thomas had a reaction to the pertussis portion of his DTaP baby shots. Within 3 days, Tommy was seizing. He was eventually diagnosed with Lennox-Gastaut Syndrome, which is one of the severest forms of epilepsy. Most of Tommy's first 2 years of his life were spent at Children's Hospital, undergoing numerous tests. He was seizing up to 100 times a day. On 2 separate occasions, Thomas was given his last rites because the doctors did not think that he would make it through the night. Thomas has been on at least 15 different types of anti-seizure medications. The side effects on some of these drugs consist of severe rashes, severe blood infections, liver failure, and yes, death. My husband and I have had to sign off on some of these legally prescribed drugs, knowing the dangerous side effects that they may have on Tommy. Tommy has also had to take additional drugs to protect his liver and has been forced to go through monthly blood tests to make sure his blood levels are not toxic. Nothing has worked to stop Tommy's seizures. He cannot walk, he cannot talk. He has a feeding tube. He also has a VNS stimulator, which is a pacemaker of sorts for his brain. We had almost given up all hope until I saw a video about a little girl named Charlotte Fiji. She was suffering from seizures just like Tommy. Her parents were giving her the oil-based medicine made from the special strain of marijuana that was high in the CBDs and low in THC. Within months, Charlotte's seizures were almost completely stopped. She is now walking, talking, and feeding herself. I knew I had to get this medicine for Tommy. I cannot believe that a naturally grown plant with little or no side effects can cause so much controversy, especially when it could possibly save my child and many child's lives. We have heard that there's no science behind medical marijuana. Well, Charlotte's Web, that special strain of medical marijuana that we'd like Tommy to try, was developed and cultivated by the Stanley Brothers of Colorado. The CBD is extracted by a chemist who once worked for Pfizer. They have professional people working on this. Like that said before, these things are not grown in somebody's backyard. It's then mixed with olive oil. Some of the doctors say that a child's cognitive and emotional development can be delayed by the use of medical marijuana. But look at my son. He has a 6-month-old baby's cognitive level. What do we have to lose? All because he has a cognitive level of a 6-month-old baby, all because of these seizures that are causing permanent brain damage and the legal pharmaceuticals that he's forced to take. At this point, we will do anything that we have to. My husband and Tommy are already signed up to move to Colorado. I will be forced to stay behind to keep working, to keep our home until we know this will work for Thomas. And then I will have to leave my job, leave my pension, sell my home, my family, and my friends so he can get the medicine that will save his life. We're asking you all to contact your local state senators and Governor Cuomo and tell them that you want the compassionate care for medical marijuana passed. Please. Thank you.